the lesions associated with the facial nerve. So we all know that the facial nerve comes from the pons, travels all the way to the medulla at the junction of the medulla and the pons and reaches the, so let us say this is the pons, and from there the facial nerve nuclei will give rise to the facial nerve. Now this is the facial nerve. The facial nerve enters into internal acoustic meatus, travels into the middle and then middle ear, and then it comes out through stylomastoid foramen. Let us say this is the geniculate ganglion. From the geniculate ganglion I get a nerve which is called as the greater petrosal nerve. This is joined by deep petrosal nerve, and ultimately they reach the lacrimal gland. So greater petrosal nerve, branch of facial nerve concerned with lacrimation. So let us say first is lacrimation, then the second branch which arises is the nerve to the stapedius. So let us say second is stapedius muscle. Stapedius muscle will prevent the excessive vibration or the hyperacusis of the ear, or too much of sound to the ear. So this is my second nerve. The third one is the Chordae Tympani, which travels all the way to the anterior two-thirds of the tongue. So the third is my taste fiber, the anterior two-thirds of the tongue except circumvallate papillae. Okay. After that I have fibers going to the sublingual and submandibular gland, so salivation. Then I have the last and the final, all the muscular branch to the face and auricle, as well as stylohyoid and digastric belly. So let us say muscular branch. Now if I have a lesion of the facial nerve at the level of somewhere here in the internal acoustic meatus before it could give all the branches, so I have the paralysis of all this, means I have no lacrimation, I have stapedius muscle paralysis which produces excessive loud voice called hyperacusis, loss of taste discrimination from the anterior two-thirds of the tongue, no salivation from the tongue, and lastly the muscles of my face are paralyzed along with the digastric belly and stylohyoid. If I have a lesion somewhere after the greater petrosal nerve, the greater petrosal nerve is the one which supplies the lacrimal gland, so I have compromised all of these functions except the first one. So I have a normal lacrimation but paralysis of all this area. Now if I have a damage below the stapedius, I have first two functions intact, rest of the three is paralyzed. if I have a lesion below the chordae tympani, so I have taste fibers intact along with the upper two functions, but I have a lack of salivation and muscular part. I will have taste sensation and salivation intact, whereas the muscular part is affected. And lastly, if I have damage only after the stylomastoid foramen, then I have the muscle paralysis of the face. Now, the facial nerve is controlled. So this is how we can remember the lesions, and we can remember the function compromised because of the lesions. Now, the facial nerve, I have the right facial nerve, I have the left facial nerve. The facial nerve nuclei are in the pons. So both the nuclei are in the pons. These nuclei are further controlled by the higher center, say cerebrum. So I'm just drawing the outline of the cerebrum. I have the right and the left cerebrum. My left cerebrum will control my right facial nerve, and my left and my right cerebrum will control my left facial nerve. So these are contralaterally controlled. These fibers are called cortico, means cerebral cortex, nuclear fiber, because they are going to the facial nerve nuclei. Also, there are fibers which comes and supply from the ipsilateral cerebral hemisphere. These fibers which comes from the ipsilateral cerebral hemisphere are the one which will supply and cover the muscles of forehead. Okay, whereas the fiber which are coming from the contralateral hemisphere are the one which will cover or control the muscles of the face below the forehead. So if I have a lesion in this fiber, say this is the right cerebral hemisphere controlling the left facial nerve, I have the paralysis of the lower part of the face, paralysis on the contralateral side, that is on the left side, but my muscle above that is on the forehead will remain intact. So the patient will have normal wrinkling or transverse creases of the forehead, but will have complete paralysis of the muscle below the forehead. This type of lesion is called supranuclear lesion or upper motor neuron paralysis. Whereas if we go back, if there is a lesion somewhere from the pons onward up to the parotid branches, this is called as lower motor neuron lesions, and this type of paralysis is called as Bell's palsy. So Bell's palsy commonly asked in your exam, so this is a very important area for your applied aspect of the facial nerve. Hope you understood the facial nerve, its branches, how the higher centers control it, and how the facial nerve is used by various other components to control the salivary gland, lacrimal gland, for the functioning. Thanking you.